Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening to all our South African listeners. Good morning and good afternoon if you are joining us from another part of the world. My name is Shahana Mia and I'm a wellness social worker in Cape Town. I'm humbled to moderate this evening's webinar hosted by the Academia Library as a tribute to frontline workers. We will engage in discussion with some esteemed voices. I'm certain it will not only be informative, but also be impactful and expanding our compassion and understanding of what goes on behind the medical scenes. Tonight we are live on ITV and we welcome our viewers. We also welcome the listenership and viewers of YouTube and our Facebook channel of Academia Library. We do know that people are streaming in from all across the world, including Kuwait, the UAE, India, Saudi Arabia, the UK, and even some of our neighboring countries in the North, West, and East Africa. So this webinar is part of a series of talks, discussions, and debates organized by Al-Ikhlas Academia Library as part of a campaign to educate and empower the community. And we're very happy to have you join us this evening. Our topic tonight is on paying tribute to the frontline workers. We do have a panel of doctors and one humanitarian worker with us, but we will be sharing and highlighting the impact on all frontline workers and what it has been for them in terms of this last year that we've experienced COVID-19. The onset of the pandemic threw many of us into a fight-or-flight response. Our healthcare workers have played a significant role in supporting, healing, easing, and assisting our communities through this. Are we, however, clear on the enormity and weight, the sacrifice that has been made on them as medical staff or frontline workers, as well as the sacrifice on their personal selves, which ultimately translate into their families as well? Frontline workers, as we know, are the backbone of effective healthcare systems. They play a pivotal role in providing a context for health solutions or interventions. Tonight's aim is to increase our understanding of the impact of the frontline regarding the medical help with COVID-19. So we wonder, are there threats to our healthcare workers? What do they face daily, hourly, or even minute to minute? The oath taken to serve the community and preserve health has placed them in a most vulnerable physical, mental, and emotional state. None of us were prepared for this. Our panelists for this evening join us from across the country. We have Dr. Shipile Klali, who is an associate lecturer and anatomical pathology registrar at Wits University. He worked as a community service medical officer at a healthcare center in the Eastern Cape in 2020. When COVID emerged, at this time, he actually led the policy making and implementations of COVID-19 safety regulations. And he then dedicated most of his time testing and treating COVID-19 patients. He is also the acting chairperson of the Junior Doctors Association of South Africa. Dr. Zolelwa Sifumba is a medical doctor and global health advocate. She advocates for the improvement of occupational health, safety, and well-being of healthcare workers. She is a survivor of a chronic disease, a mental health illness, as well as COVID-19. And as a result of the occupational hazards in the medical field, she featured at this year's celebration of Commonwealth Day, speaking to the Duchess and Duke of Cambridge regarding the struggles faced by healthcare workers globally. Dr. Hussein Khalfi also joins us, and he's a specialist pulmonologist and UCT lead at Life Vincent Pallotti Hospital in Cape Town. He usually sees to and manages the critically ill and mechanically ventilated patients in the ICU. With the onset of the pandemic, his role as part of a multidisciplinary medical team has involved managing all the critically ill COVID-19 patients. And then our fourth panelist is Brother Yusuf Mohammed, who is the CEO of the South African branch of Islamic Relief, the world's largest Muslim humanitarian organization founded in the UK in 1984, with the South African office operating since 2004. Islamic Relief has to date saved and transformed the lives of over 117 million people by responding to disasters through sustainable economic and social development projects. So I extend a very warm welcome to our panelists, and I look forward to the discussion and hearing your shared perspectives. Our format for this evening is quite simple. We'll invite each panelist to share their narrative as a frontline healthcare worker for a brief 4 minutes, please. Thereafter, we'll engage in some open discussion about these paradigms. And we also invite and encourage our listeners and viewers to forward any questions via our social media platforms, and we'll endeavor to answer as many as we can within the time frame that we have. So now I'd like to ask the panel to please just, in order of me calling them up, to set the scene for us for about 3 to 4 minutes. Dr. Sipile Tali, are you able to come up now? Thanks.
Good evening, everybody. Thank you for that introduction, Shahana. As you've briefly stated, my experience with COVID started at Nontyatjambo Community Health Center in Mdantsane in the Eastern Cape, which is colloquially known as the second largest township in South Africa. I started working with COVID before it actually reached the shores of South Africa, due to the fears that were surrounding the oncoming pandemic. There were a lot of fears and a lot of myths that surrounded it, and because of that, I started reading around the virus itself, and that's when I was captured. By the time it hit the shores of South Africa, I kind of felt that it was a calling for me to stand up and fight this virus, as it was requested by the president of our country, that we should stand up and heed the call and face this virus. Little did I know how challenging it would be. It was probably the toughest year of my life in terms of my career. But yeah, thanks to all the support that we got at Nontyatjambo, we really got through it. Since then, I've worked with Becky Sisa, as well as the Healthcare Workers Care Network, to advocate for mental health for all healthcare workers in terms of what we've been experiencing through this pandemic. Yeah, thank you. That's all from me for now.
Thank you very much, Dr. Shapilo Tlati. Okay, now we'd like to ask Dr. Hussein Khalfi, if you can please just set the scene for us for 4 minutes. Thank you.
Assalamu alaikum. Good evening, everybody. Shahana, thank you to you and the Academia Library, Al Ikhlas Academia Library, for inviting me to be part of your esteemed panel and diverse panel, really. I'm Hussein Khalfi. I'm a physician and pulmonologist at Vincent Pallotti Hospital, which is a private hospital in Pinelands. And I've been there for just over 10 years. And really my role as a pulmonologist involves seeing patients with a spectrum of respiratory diseases, but also managing a lot of patients in ICU. And especially with the onset of the pandemic, we were involved in setting up structures in the ICU in preparation for receiving the critically ill in the ICU. And I was very lucky to be part of a good multidisciplinary team. So we had a number of physios and speech therapists and occupational therapists and lots of doctors. We had 2 nephrologists and a physician on our team, and lots of nursing staff to help out in the ICU. So we were, at that stage, we thought well prepared for receiving our first few patients in the COVID setting. But yeah, as we go along, we'll talk about all of our experiences. So that's it from me. Thanks.
Thank you very much, Dr. Hussein. Dr. Zulelwa, can you please grace us with your presence?
Hi, good evening, good morning, good afternoon. Hello, everybody. Thank you very much for having me today. So yeah, thank you very much for that introduction. I hope everyone can hear me. So yeah, I am a medical doctor, and when COVID hit South Africa, I was doing my community service at a hospital in rural KwaZulu-Natal. So I was initially very anxious and scared because it was said globally, that people who had comorbidities were going to be at higher risk of contracting COVID. And I had had a previous history of contracting multi-drug resistant tuberculosis as a medical student. Um, so I was very anxious, about my own risks of contracting it, especially in the face of the PPE shortages that we were facing nationwide, as well as some issues in infection prevention and control. And that is just regarding, seeing people that are symptomatic of COVID in certain areas, and seeing other patients that are not symptomatic in other areas. Anyway, a few months into the pandemic, I contracted COVID, and it was scary because I had seen many people coming in, with symptoms similar to mine, and later that evening they would have died. So it was just quite scary, and the frenzy globally that there was, about what is COVID, where does it come from, how do we treat it, where do we get vaccines, and you're there as the doctor as well, and you have to answer people's questions. And now I was the patient, and again, I was the patient again because of how unsafe, the hospital environment can be at times. And I'll further unpack that in my talk. But it was a very tough year for me. And even now, I am currently not on the front lines because I'm still quite, anxious and afraid of my risks of contracting COVID in the face of, the shortages that we have been having. But thank you very much for having me. And I hope, we continue to conversate.
Thank you very much, Dr. Zulelwa. And now, Brother Yusuf Mohammed, you can take to the screen.
Assalamu alaikum, good evening. Thanks, Sister Shahana. And good evening to my fellow panelists. Assalamu alaikum. It's really a privilege for me to be part of this esteemed panel this evening to give tribute to our frontline healthcare workers. As you mentioned earlier, I'm the CEO of Islamic Relief South Africa, which is the largest Muslim faith-based humanitarian NGO in the world. We currently have presence in over 40 countries, and Islamic Relief South Africa being just one of the branches. Our mission in a nutshell is to make the world a better and fairer place, especially for the 3 billion people who are still living in poverty. So from that aspect, I can speak of frontline workers being the humanitarian workers, and it's a privilege and honor for me not only to represent Islamic Relief South Africa in that regard, but the thousands of workers for NGOs and CBOs who were really on the front lines during the past 12 months during which South Africa experienced lockdown. And from that perspective, I don't think one program is sufficient to give a suitable tribute to them, but it needs to be done. And it's just a privilege for me to be here, and hopefully I can share some experiences that we have learned of being on the front line from a humanitarian perspective as Islamic Relief, which is reflective of other NGOs that's similar to ours. I look forward to the engagement this evening. Thanks.
Thank you very much, Brother Yusuf. I think listeners and viewers, you'll agree with me that we have a beautiful panel this evening. And really the discussion will hopefully flow from there to give us an understanding of the sacrifice that they have been placing on their plates in terms of engaging with people involved, and from the frontline perspective, as well as patients who have actually been diagnosed with COVID-19. Brother Yusuf, I do agree with you that one discussion is not enough, and hopefully this is a spillover in terms of many discussions, not just in a webinar format, but also in your home environment. People, we encourage you to just engage with these discussions, because it is something that is part of our present, which will become something as part of our history. And we want to be able to acknowledge it fully and become fully engaging with what is happening to us and how we are affected by it. So I would like to ask Dr. Khalfi a question. Dr. Khalfi, how important is it and how necessary is it to acknowledge the sacrifice health workers have made?
Shana, I think that's a very good question. Look, the sacrifice is huge. And if I recall, when we admitted our first patient in the ICU, how anxious we all were. We intubated and commenced the patient on ventilation on a Sunday morning. And then by the Sunday evening, we had a second patient admitted. And I could see the anxiety. I could see the anxiety in my family's faces. So you can imagine how anxious the staff were, because we were preparing for this. And now suddenly we have 2 ventilated critically ill patients, and it's all foreign to us. We've been reading about it in the news about how staff have been affected and infected, and how doctors have died and nursing staff have succumbed. So understandably, there was a lot of anxiety. And if you think about it, we've got young individuals, but also older staff who have comorbidities, colleagues who've got comorbidities, who put their lives on the line to manage these really ill patients at the expense of, number one, spending time with their families. So during this lockdown period, where many people were worried about spending time at home, how they're going to homeschool their kids, what they're going to watch on Netflix, how many circles they're going to run around the house, etc. We had to go to work, and nursing staff had to go to work, and physios had to go to work and sacrifice time away from their families, but also risking their lives in the process. So I think it was a huge sacrifice, and really they must be complimented for that and recognized for that, particularly from a nursing staff perspective, I would say. They tend to spend the most time with the patients, and they're there for 12 hours at a time.
Thank you very much, Dr. Hussein. Now, Dr. Zulelwa, would you maybe like to highlight a little bit for us in terms of who actually is termed a frontline worker? We have doctors on the panel. We have a humanitarian worker. There was mention of the nurses. Who else besides medical personnel would we regard as frontline workers?
Hi, so I would regard anyone sort of on the cold face of COVID, who is nursing people who are actually ill or supporting the services. So even within the hospital, for example, a lot of people will think the frontline workers are just the doctors and the nurses, but people won't realize that the porters, the cleaners, the admin staff, every single person, and this is why I'm saying the community healthcare workers as well are frontline workers. It's not just, the doctor and the nurse. It's everybody, I think, who is involved, in basically the first response to get the globe sort of in better standing with COVID. But obviously in this context of frontline healthcare workers, we're talking about the people in the hospitals, in the clinics that are there every single day, fighting the pandemic and trying, to keep people alive. So yeah, it's quite a broad term, but specifically, I think today, which is really great, is we're focusing on the health workers as a group that hasn't really been focused on throughout the pandemic. I'm just really excited to be here and that we're having this discussion about frontline workers. Yeah.
Lovely. Thank you very much for that. And I do agree, we need to recognize all the staff that are involved in the medical fraternity that are exposed to patients coming in. And I'd like to ask Brother Yusuf, perhaps if you can comment on the frontline worker, because obviously as a humanitarian worker, being on the ground with Islamic Relief, you are also, and your team is also on the front line. Can you just share a little bit of that with us, please?
Yes, thanks, Sister Shana. Yeah, in South Africa, especially, it's particularly a country where we have a huge proportion of our population that are living in poverty. And as we know, our the capacity at hospitals, and Dr. Umar can give us some more insight into that, and the other doctors on the panel, we are limited. So as a humanitarian frontline worker, our objective was try and keep people as the COVID protocols had advised to minimize or limit movement. And as we know, in many of our poorer communities, this is literally impossible. People who live especially from, hand to mouth, or have, below the average income, these households, people can't afford to stay at home. So as Islamic Relief South Africa, over the our objective or mission in South Africa had always focused on sustainability and capacity building programs. When the pandemic broke out, then we had to shift a lot of our focus to food security, providing people just with the means to survive, to stay in their homes. And this was a big challenge. Islamic Relief was only one. As I said, I'm here representing, or as the CEO of Islamic Relief, I'm not only representing Islamic Relief, I'm representing the entire humanitarian sector, people that were really, in many cases, risking their lives in order to protect others. And this was to prevent people from moving, as I'd said, and thereby limit the spread as much as we could. It was difficult, but under the circumstances, I think those frontline workers also need to get the necessary acknowledgement for their efforts.
Absolutely, I do agree with you. And thank you so much for representing all those masses of people who are out there. We've heard of people that just take on to whatever resources they could to be able to help out. So it may have been somebody that started a soup drive. It may have been somebody that collected something and dropped off at homes where they were COVID patients. We need to recognize them also as frontline workers because they were out there assisting and helping. And it reminds me of Maslow's hierarchy. If we are recognizing the physical needs and the physiological needs of people, those are the baseline needs of people. At a time like this, when we have all been thrown out through the pandemic and taken into another level completely, not knowing where to turn to and what resources to get our hands on, people have engaged and people have risen above that to be able to ensure that they can benefit and be of benefit to humanity on a large scale. Thank you. So Dr. Tlali, I'd like to ask you if you can share with us some perspective on community centers, because that's where you've been based. And is there a difference between what community centers are experiencing in comparison to perhaps a private institute? We know there's limited resources. We know there's a real reality around the structural infrastructure of community centers. How realistic is it to implement change and coping methods in this type of setting?
Thank you for your question, Shahana. Working, I think, community health centers, I would also like to group it with hospitals. It's just the difference is maybe how sick the patients you see there are. But, to start off with, we are in the community health centers, we were already stretched in terms of resources. And now you bring a whole new pandemic, which comes with a whole new problems. Numbers probably quadrupling in terms of the number of patients you'd see a day. It's very difficult on one's physical health and mental health. And so we really struggled there in the community health centers. Now, it became even more difficult when we had to really start kind of rationing who would test and who would not test. There was a guideline which was released in the probably midway of the first wave, where they said that rather, because the National Health Laboratory Services were quite stretched as well in terms of the number of tests which were coming in, let's rather test people who are high risk and those who are frontliners. And that meant that, of the, say, 200 people who are lining outside, you'd only be able to test about 50. The other 150, you would tell them to go home and isolate. And you wouldn't really, you don't have any way of knowing that that person is going to isolate. And also you don't know whether that person is infectious or not, and whether or not they're going to go and spread the potential virus that they may have at the time. And that was not easy as somebody who's supposed to be protecting and caring for people, to just turn them away and tell them, listen, just stay at home and just isolate and don't do anything. And a lot of the time they'll come and say, yes, but doctor, I'm living with a very sick person. And in as much as you would sympathize and empathize with them at the time, there's really nothing you could do. You asked about coping mechanisms. I think as healthcare workers in general, we've got horrible coping mechanisms. the the health field is a very, very difficult one, and understandably, as a healthcare worker, you try to find the best way to cope in order for the things that happen around you not to affect you. But in the long run, it's really not healthy, and I would like us as healthcare workers to really, really, really take our mental health care very seriously, and to be okay with not being okay, and to not associate your unhappiness or your dysthymia, sorry, to a lack of competency. It's okay for you not to be okay. I know we've got this superhero complex and we really want to help everybody, but we're also human at the end of the day. Thank you.
Thank you very much for your input. Really appreciate it. And I think it brings me to a post that I recently saw where there was a healthcare worker in full PPE carrying a patient in a hospital bed while he was walking through neck deep water. So, this image we have of the frontline superheroes, is that a real image? And one of the questions that have come up through our social media platforms has asked that question. How do you, as the panelists, feel about being termed a hero during this pandemic? There have been many movements on social media acknowledging frontline healthcare workers by lighting candles and clapping. Do you, as a doctor, feel that this was honoring to you and your sacrifices? So I open it up to the panel if anybody would like to respond to that question that's come through.
Um, is it all right if I respond? Hi, everybody.
Yes, thank you.
So I have a problem, with being termed a hero, because when we think of heroes, we think of Superman. And Superman, came from wherever he came from. He would save people and then he would leave. Nobody would be worried about what he was eating, what he was wearing, if his kids were going to school. The problem is we're not superheroes, we're humans. We are everyday, regular people who felt a calling, to go into healthcare. And we went because we want to help people. The problem is right now is that, the campaigns and the thanking of healthcare workers globally has been great, and it's been appreciated. But I think the one thing that has been lacking has been tangible support. Um, and I think it's been tough on the front line, even before COVID hit. As I said, I am a drug-resistant TB survivor, and I contracted the TB in the hospital as well, same place that I contracted COVID. And this is because healthcare workers everywhere are falling ill, and I think COVID has actually has shown the world that as the healthcare workers on the front line, we are actually at so much risk, so much increased risk of, contracting such illnesses, And I think my biggest call in my own advocacy work has been asking for people all over the world, people, everyday people. I think everyone knows a health worker, everyone knows a frontline worker. I have been asking and calling for support, If you know a frontline health worker, love on them, offer to look after their kids if you need to. We're not these heroes that kind of just fly in, we're also breadwinners, we're also daughters, we're also mothers, we're fathers, um, and we need tangible support. We need psychology sessions. The way we've been seeing death for the last few months has been so hard, and I've been so anxious going into work every day, scared that I would contract the virus, scared that I would die, like the many other healthcare workers that have died on the front line. So I think for me, it's problematic to be termed a hero. The work we do is hero-like, yes, but we also are human, and a lot of us are pouring from an empty place right now. So I think, yeah, my advice, to everyone right now is to just love on a health worker. If you can help with a meal, literally anything you can help with would be appreciated, so that we can also lift humanity. We also need support. We need to care for those caring for us. So yeah, that's. what I have to say.
Thank you very much for highlighting that. And obviously, your voice has been heard. There are very practical steps that you've mentioned to us. And it's something that we want to be able to encourage and to highlight this evening to all of our viewers and listeners. You know, like Dr. Zalelwa said, even if it's just a plate of food or a pot of food, perhaps offering other kind of support to the family of the particular healthcare worker. It's something that may seem very small, but it's definitely significant in their eyes and in their lives, and it's something that we need to take into account for that. I'd like to go to another question that's come through. It says here, what has been the extent of the strain placed on the families and extended families of the frontline workers? So maybe Dr. Khalfi, would you like to take that question for us, please?
Yeah, sure. I guess I alluded to it earlier on. It's been rough for the families. I think to see your loved one, your spouse, or your mum or your dad go into work every day to go and see ill patients and be at risk of contracting the infection themselves and be at risk of dying, really, to be blunt, has been difficult. It's been difficult for my family. It's been difficult for my colleagues and their families. I've seen it from the nursing staff in the units. So I think the strain is huge on the family. And I echo what Dr. Klali has said and Zolelwa has said. There hasn't been too much support, but I don't think people knew how to support in this situation. It's just been so foreign. It was really like a tsunami hitting us. So I think the strain has been huge. It was really particularly bad in wave one, where there was a worry about everything, about the extent of the the outbreak, what its effect would be on the patients, what the effect would be on the healthcare workers. Would they all succumb? Would they survive this? Would the PPE be effective enough in preventing infections? And then the stresses in wave two, I think, on the family were perhaps slightly less, because we now had some experience about it. We knew that if we had access to good PPE, then it would work. But obviously, there's been a big divide in the availability of PPE between public and private, etc. So we were sort of saved that stressor. But yeah, I think the families took a lot of strain. For one, I could see a lot of worry in my family's eyes. I could see a lot of worry in the families of my friends. Some of my friends got ill. One of my friends ended up on a ventilator. So it was rough. And I don't think one can really sort of explain in words exactly how much this pandemic has affected us all emotionally and psychologically. I think it will leave its mark for years and years to come. Yeah.
Thank you very much for that. And you've actually brought to our attention quite a few aspects. I want to go to the issue of PPE, because we have a question that's come through in terms of how have the frontline workers dealt with the issue of the shortage of PPE? So maybe, Brother Yusuf, if you can tackle that question in terms of being a humanitarian worker, was Islamic Relief called upon to be able to assist in providing or, getting some facility available to allow for more PPE be available for our frontline workers?
Thanks for that question, Sister Shana. From Islamic Relief's perspective, we weren't really involved in procurement of PPE other than for our staff that were engaging, whether on the front line or, engaging with or in working in areas where there was a possibility of them contracting the virus. I do know, just because we were approached by many other organizations, smaller NGOs working in the communities, and other community-based organizations, we were approached as to whether we could supply them with PPE. And I think one of the important lessons that we took from the pandemic is that we are all in this together. And wherever we were able to assist and support other organizations, we do that. When we did, because we had people approaching us, donating PPE to us, and then when there was a need by other organizations, then we pass it on, donate it to other organizations or to those working on the front lines. But we weren't really involved in procurement ourselves, other than, as I said, for our own staff. So, I don't think I can give any further comment on just the challenges faced by hospitals when it came to procuring PPE.
Okay, sure. Thank you very much for that. Does anybody else want to add into that? Does anybody have some experience with that, perhaps?
Yeah, I think I can come in here.
Thank you.
So PPE, like PPE to start with, before COVID was a problem. I think I've got experiences from internship where we would kind of, what is it? Kind of not fight, but like we kind of battle to even have an N95 mask, which was the standard for treating TB patients. And now when COVID came around, you really saw the deficiency that we had. And I would like to applaud the government for really, really boosting the amount of PPE that we had initially. But obviously we had challenges maintaining the PPE which was needed to protect all healthcare workers from contracting the virus. Unfortunately, we've all seen stories in the news and everything about how people have contracted the virus from due to the lack of PPE, and because of that, we've had to learn ways on how to stretch our PPE for as long as possible to make sure that at least we're protected. If you read any box for any mask, it says that you should use it once or at most for 4 hours, and we couldn't do that. There's not enough masks to be able to do that. So what we had to do is learn to use it for a whole day or 2 days, depending on where you were, and you had to learn how to keep it good. So like you had to keep it dry, make sure that it's dry, make sure that you don't contaminate it with anything, and that at least got us through. But yeah, no, the PPE thing was a major challenge.
It sounds like a stressor that could have been avoided. Obviously, with the pandemic being around, and there has been an influx of experiences, PPE was something that was definitely required and needed. And being on the frontline work, those kind of stresses is something that you wish would have been different and deferred from what you're experiencing altogether. A question is coming from Shanaz, and she's asked, how do doctors and nurses particularly deal with patients who they know will not be pulling through? Maybe Dr. Khalfi, will you like to take this question, please?
Sure, thanks, Shana. Thanks for the question. Yeah, look, it's so we often have to make these decisions, and not all patients pull through critical illness. We know that in the best of circumstances, if one is in ICU and you're critically ill and you're on a ventilator, the chances of surviving that are not great. So when we add COVID into that equation, the chances of surviving ventilation is even lower. So in wave 1 we had better outcomes. In wave 2 the outcomes were even poorer on ventilators. So part of critical care, unfortunately, is also dealing with end of life decisions and guiding the family members through the process of accepting that the patient is not going to survive. It's incredibly tough because we've had so many deaths across the country, across the world, in ICUs. There have been so many deaths, and healthcare workers are not programmed to be dealing with so many and processing so many deaths in any one given time. And so it's hard. But we talk, we've had a good support system in our hospital in particular. We had some counselors who would call the families daily, and we would call the families daily. And we would sort of prepare them for the inevitable when we get to that point. And the difficulty with COVID is it's such a random disease. So if you end up critically ill on high flow, it's really difficult to predict who is going to end up on a ventilator. And if you're on the ventilator, it's even harder to predict who is going to survive that. And so there's so much uncertainty. So you can imagine how difficult it is for the families to also talk to us daily and understand why we are we sort of we'll be cautious about what we say and about getting ahead of ourselves. So yeah, it's an ongoing process. We talk daily, but what we've learned from COVID is that it's a real sinusoidal pattern. Sometimes we see improvements, other times we see deteriorations. But when we know that the end is more likely, then we try and provide as much support as we can. In the beginning, we weren't able to allow anybody into the hospital to see their families. In wave 2, we've sort of been able to adjust that arrangement, but it's hard. And I think just ongoing open communication makes it easy, but it's not easy for both the clinicians, the healthcare workers, and of course not for the families. And we've been doing this repeatedly since April last year, going through the process with families and patients who haven't survived. So it's not easy, but part of medicine is not just healing, but also easing the process of palliation and dying, unfortunately. And we've got to accept that modern medicine can't really slow the process of aging, and we are limited in what we can do for many illnesses. Yeah.
Thank you for that. And I'd like to ask you for a quick minute to be able to perhaps share with us, just in terms of what you were saying, easing as well as the anxiety that doctors are facing. Is there a difference between the pain of losing a patient to COVID-19 in comparison to losing a patient of another disease or disease?
I think there are big differences. They're polar differences, right? So if you think about this, anybody who dies of a non-COVID condition in a non-COVID environment, before this whole pandemic, you could come into the hospital, you could be with your loved one, you could come in every day, twice a day, thrice a day. You could be there at their side, you could pray for them, and you could have more than one family member coming in. COVID has thrown that completely out of the window. So you end up with a really impersonal situation where you have a family member coming into a hospital, and if they're unfortunate not to survive that, then that would be their last contact with you. And in addition, the last thing they would come into contact with is somebody with PPE, behind a mask, a face shield, multiple layers of gowns. So it's really a terribly impersonal situation to be dying in a COVID environment. But having said that, we've tried to soften that to some extent with, which is the inherent way of the human nature, isn't it? We try and spend as much time as we can at the patient's bedside. We've been doing video calls. We've been sending pictures to families, and if the patients are unconscious, we play voice clips for them. We've had a really supportive group of counselors and occupational therapists and social workers who would come in and play these voice clips to the families. So dying in a COVID environment is very different to dying in a non-COVID environment. And it has important life lessons for us all. If I must be philosophical, life is just so short that, when we see what happens in COVID, it makes one wonder about all of our petty little fights that we have that we see every day.
Thank you very much for that. And, I think it's something that we need to be take into account in terms of the compassion and the impersonal nature of things right now, which we are obviously following protocols, and yet it just cut off our humanness with other people. Dr. Tlali, I think you have something to add to this as well.
Thank you, Shahana. I just want to add a different perspective. Somebody who was in a different setting as well as in a very primary setting. When I think it's one thing having a critically ill patient with an irreversible disease, that you keep them comfortable, we palliate them. It's another thing having somebody come to you and needing oxygen, but already there are 5 people who are on oxygen and there are 3 other people waiting for oxygen. As a doctor, we believe that you try to save life, and when you're sitting there and you have to ration oxygen and patients are dying because you just don't have what we believed or what we've always taken for granted to be something that's always available, that takes away something from you. And knowing that sometimes there are no ambulances and you have to tell the patient to, with their very low oxygen saturations, to get into a private car or hire a taxi or something so that they can quickly try and rush to the referring hospital. And on their way there, you're not even sure if they're going to make it, and that takes away something from you. That for me was something that changed how I saw being a doctor for the rest of my life. Thank you.
Thank you for your input. Much appreciated. There's another question that's come through, and this is for Brother Yusuf. Do humanitarian agencies such as Islamic Relief have contingency plans to specifically support healthcare workers should there be another wave or similar pandemic?
Yeah, that's a good question. During the pandemic, we've worked very closely with the disaster clusters in all regions where we have offices. So in the Western Cape, Gauteng, and KwaZulu-Natal in particular. But we've worked in some of the other provinces as well. We are in the process actually of we're about to start a project with the Gauteng Department of Health in order to increase their capacity to deal with special needs patients at the Chris Hani Baragwanath Hospital. A lot, as with any NGO, we are limited in terms of the funds that we have to support various, causes around the country. And before the pandemic started, as I mentioned earlier, our focus in South Africa as Islamic Relief has always been on sustainable development projects. The adage of giving the person the fishing rod instead of the fish. And this is still something, while we are now currently, we are very much involved with the Department of Social Development in all three provinces, providing food packs to families that are really in desperate need. We're also continuing with our sustainable development projects, because at the end of the day, this is part of what we as a humanitarian organization can do to prevent the impact or to limit the impact of such types of disasters, whether it's a pandemic or any other disaster. To limit the impact, preparedness is key. So we try and make communities as far as possible resilient to the types of disasters, although nobody had anticipated a pandemic, but that's even something we have to prepare for now. As they say, this is something that could be recurring again in the future, whether it's a third or fourth wave of the current pandemic or a new pandemic. So we need to prepare communities, but we work very closely with all stakeholders, whether it's the community-based organizations, whether it's government, private partnerships, even with corporates. We have to bring all sectors together, because everybody, as I mentioned earlier as well, that COVID taught us that we are stronger together, and we are in this pandemic together. So we do work closely with government and support wherever we can. And but as I said, limited in terms of funding that we have available for such projects.
Thank you very much for that. And, it's important for us to realize the resilience of people, of communities, as well as the normalizing of things. So I'm going to a question that's come through from our YouTube. Zarina, who's watching the webinar on YouTube. Thank you for an informed webinar. Knowing that COVID is here to stay, what is the best way to normalize, to be vigilant, and still to be normal? It has brought on a great deal of confusion. Dr. Zulelwa, perhaps you could take this question, if you don't mind, please, in terms of normalizing.
In terms of normalizing,
yes.
This is quite a tough question that you're asking me. But I think the world has changed,
Okay, should I go to someone else? Okay. It seems like Dr. Zulelwa has been having some challenges in the Eastern Cape, so we'll just go to the next question, and hopefully she can log back onto our channel. We've got here a question that's come through. What steps have you as frontline health workers...
The world has changed a lot within a space of a few months. And
okay, Dr. Zulelwa, we're going to mute you for now, and once things are a little bit more stronger on your side, we'll unmute you to continue answering that question. Thank you very much. I was just reading out a question that's come through. What steps have you as frontline health workers taken to protect your own physical and mental wellness? So I know as a social worker, we often speak about self-care in terms of the balance of your mental, physical, your emotional well-being. And if you find that it's not aligned, then you need to take measures in terms of realigning that. So in terms of you as frontline workers, this question is asking, what measures have you been taken? Dr. Hussein, would you like to answer that? I know you briefly mentioned something earlier, but maybe just expand on that first, please.
Yeah, I think it's important to have some kind of outlet, right? So in my situation, I'm only in the ICU, so I only really see critically ill patients, and they have the worst outcomes. We've got a separate team working in the ward, and generally many of the patients in the wards would do well unless they need to come up to ICU. So we tend to see a lot of critically ill patients. There's a lot of bad outcomes, poor outcomes, and it's important then to be able to step back and refresh yourself and recharge the batteries and find some kind of outlet. So personally, from my perspective, I run a lot. So I make sure I end up doing exercise 4 to 5 times a week, just to run and clear the mind. And you need to have some kind of alone time where you can be alone and just clear your mind. I also find that communication with the family helps. Because the closest one to you is your spouse, and speaking and debriefing is very important. And then we've been fortunate enough to have a good team of doctors in our unit. So there are 4 of us in the unit, and we make sure that every day we would have coffee after our morning round, and we'd support each other through that. And we all brought different strengths to the team, and then of course we debrief with the nursing staff and all of the allied clinicians as well on the team. So for me, communication was an important part of coping with all of this, and some alone time with in terms of exercise and some family trying to find family time as well has been vitally important in keeping us sane amidst all of this chaos.
Thank you for that. And I think, it sounds as if there has a need to be encouraging a lot more of your self-compassion, self-care time, whether, like you say, it's alone or with family, to take note of that and to allow yourself the processing of what you're experiencing on a very regular, very real, and very painful basis. I see Dr. Zulelwa is back, and if you're okay, can you just perhaps continue with what you were asking, what you were answering in terms of the normalization question? Thank you.
Yes, hi. Apologies. I'm really sorry about the network issues. So yes, as I was saying, the world has changed, and I think it definitely has been very traumatic for all of us. And I don't think many of us have actually come to a point within ourselves and decided to actually mourn the loss, because all of us have suffered losses, to mourn the losses that we've suffered and to understand that, life, I think we've never, been in control of what is happening and what's going on and what is about to happen. But I think what we can do now moving forward is just trying to be together and be more supportive of each other, and more than that, to be with ourselves in a way that we are healing ourselves, and we are also, and when I say healing ourselves, I mean psychologically, of the stress and the trauma and the pain that we're all facing, and just come together and support each other as people and as, so that we can actually get through this. It's going to be tough, but I think we can do it if we come together as a global community to actually understand that this is where we are and what do we need to come together through this as humanity.
Thank you very much. And definitely we are experiencing this as a collective humanity, a collective society, a collective global experience. And it's something that we need to take lessons from. It's been a year, and now we'd hopefully like us to be able to learn from what we've experienced to take on further from there, because this will not be gone away completely, but there is a new norm that's coming through, and we need to be able to learn in how to deal with this in a lot more effective way. Dr. Klali, I'd like to ask you the next question, which has come through. How differently will doctors and nurses deal with a pandemic of this nature now that they have about a year's experience in dealing with a pandemic?
Wow, that's a difficult question. I think the difference between now and last year is the level of anxiety that comes with COVID-19. I think at first everybody was running away from COVID. You think you have somebody coming in with upper respiratory tract symptoms, and there'll be such a panic that surrounds that patient. And I think with a year's experience that we've had in terms of treating COVID patients, that kind of anxiety has gone away. I think obviously our colleagues are still very scared of contracting the virus because, as we know, if you get it, you don't know what's going to happen. So yeah, I think the main difference would be the level of anxiety and how much people interact with COVID PUIs. Thank you.
Thank you for tackling that question. I know some of them are quite tough questions, and yet it's something that the listeners would like to hear from you, to be able to give them perspective on what you as frontline workers are experiencing, not just you personally, but the broader context of frontline workers. So, Brother Yusuf, I'd like to ask you, what has been the greatest challenge in the vulnerable communities that you serve? Is there fear? Is there anxiety heightened? Perhaps you can share a story with us of something that normally goes unnoticed, and just highlight that for us now, please.
Yeah, where does one start? The challenges I think that our vulnerable communities have faced. It's like most vulnerable communities. We can speak about South Africa firstly, where communities generally have been going through, a kind of a lockdown scenario even before COVID. By that I mean families were experiencing going for days without food. But what COVID has done is just kind of multiplied the effect of poverty for most vulnerable communities. So there's quite a number of stories that I can share with the listeners, maybe just to give an insight into what life is like on a daily basis for our fellow South Africans. Starting from maybe a lady that contacted us, and I remember receiving the message, from this lady. We got it in February, and I won't mention the lady's name, but she sent us a message, and she said that the last time that she had a meal, she pleaded with us to, if possible, to deliver a food pack to her, because she said that the last time that she had a decent meal was on the 16th of December. And for me, this really, it really hit me so hard, because this was February, and to me, this lady could remember the exact date that she and the children had last had a decent meal. And obviously, it puts us in such a difficult position, because there's a limited capacity that we have as Islamic Relief. I mean, we may be a big NGO, but even so, our capacity is limited in terms of reach. We can't reach everyone. But when we get a request like that, you have to think about so many other factors, like how many other families living around that lady would also be in need, and it would be unjust for us to go into a community and only assist one person, and then the other, and leave maybe all her neighbors who are in a similar situation, without any assistance. So we have to look at ways of then engaging with other organizations that are working in those areas to coordinate with them and to see how we can provide assistance, because the lady approached us, and there was another incident where this gentleman came to the office, and again, I'm trying to not give details because to protect the person's dignity as well. But a gentleman came to our office and he stayed out. For people who know Islamic Relief in Cape Town, our offices are in Imam Harun Road, and it's the area around our office is not what you'd call a poor community. It's about you'd say classified as a middle class community. And this gentleman came to our office and he said that he was in the building industry. This was in last year during May. And he said since the lockdown had started, him and his family, he'd been unemployed. So he lived just a few roads away from our office, but he didn't have food for his family. And again, in a case like that, your heart just goes out to the person. How can I help you? What can we do to assist? But then you think there are so many other people that are also in need. And, I think that in itself, apart from, and I'm sure, the trauma that doctors experience when you have a patient that's on, a ventilator and there's very little chance that this patient's going to survive. But there's a psychological trauma that goes with, working in the humanitarian sector, where you become aware just of the plight of people. And you just feel that, you wish you could do more, but you're limited in terms of resources to reach those people. It's a long story. If I must share, it's a really touching story though. But this gentleman, actually, if you don't mind, just give me an opportunity just to share this guy's story, because this story, it will probably stay with me for the rest of my life. Because it taught me many lessons. This guy, we told him, look, we deliver a food pack to his house. And then he told me about another friend of his who was also in need. And then what we did was I contacted a friend of mine, because we don't like to generally give food packs from our office. Otherwise, it'd be a kilometer-long queue outside our office of people wanting food packs. We generally work through community-based organizations, the ones that deal with people on a daily basis in the communities. But in our area or surrounding areas, we don't work with any community-based organizations, because we don't expect people living in those areas to be in need. But anyway, long story short, the one food pack was supposed to be delivered to this guy, and then he contacted us afterwards to ask, when the food pack was going to be delivered. And when I inquired about it from my friend who was supposed to deliver the food pack, he told me, no, the food pack was definitely delivered. And then when we did some investigation, the food pack was actually delivered to someone else's house. And this guy who received the food pack, he was a non-Muslim guy. As Islamic Relief, we don't only assist Muslims, we assist everyone, of all religions and none. Anyone who is in need, we try and assist them. But anyway, he went to this person's house, and this person opened the door. Firstly, the guy that delivered the food pack, he said he went to the house and he thought to himself, but it's strange that I'm delivering a food pack to this house, because it doesn't look like these people are in need. It is a middle class home. And he went to the door, and the guy opened the door. The guy told him, but how did you know that I needed a food pack? So the guy said, well, somebody sent me to deliver it here. And the guy, he started crying, and he said, look, I didn't ask anyone for a food pack. But how did you know that I never had food for my family? So he said, look, I didn't, I'm just a delivery guy. So what had actually happened was he delivered the food pack to the wrong address. And in the area, Rondebosch East. And that story, like I said, will stay with me for the rest of my life for many reasons. Firstly, I think to myself, how many other families are going through similar situations or experiencing similar situations, but they won't ask. They won't reach out to anybody to ask for assistance because of pride, or just out of not wanting, maybe being ashamed to ask. And also the fact that it was delivered to a guy, And I always tell our staff, I use this as a lesson, for all of us. I said, if something was destined for somebody, I said that food pack was actually destined for that guy. He maybe never asked for it, but the Almighty had destined for that food pack to reach him. And it's like, there are cases of, we know of so many families, the kids are at home, but they are unable to attend school because they don't have access to internet. So, those aspects of COVID and how it's impacting children, you must keep bear in mind that if children can't attend school, you're impacting the education, you're impacting their future. And that can be, majority of the kids that are living definitely in rural communities and many of the poor communities in the metropoles. So, there's many other stories like that. And I think it's important for us. Doesn't matter how difficult our situation is, that we always reflect on those that are in a more difficult or more challenging situation.
Absolutely. Thank you so much for sharing those stories. I think it was important for us to become aware of what you are experiencing, to become aware of the vulnerability upon vulnerability upon vulnerability that people in our community are suffering. It's not just about physical challenges and the impact of COVID in that respect from a medical point of view, but some people's lives have always been in a vulnerable position, and now this, as a pandemic that's come through, has added on to those stresses. A question has come through, and I've also just been wondering, as the medical fraternity, if one of you doctors could answer this in terms of, are you sensitized, or do you think doctors and the medical staff become desensitized to what you are experiencing because it's on such a large scale? So anyone on the panel, one of the doctors perhaps, please?
I can come in on this one. I think earlier I spoke about the bad coping mechanisms that we doctors have, actually healthcare workers in general. The issue with something that happens at such a magnitude is that you have to desensitize in order to cope. If every patient you lose hits you where it hurts the most, by the time you lose your second or your third patient, you won't be able to treat anyone else. And one would think that the process of desensitizing actually will help you, but in the long run, actually it will destroy you. So unfortunately, yes, we do, but I don't think it's the best way forward. Thank you.
Thank you, Dr. Tali, for that. Dr. Hussein, I'd like to ask you a question. Can you speak to us on how treatment for non-COVID-19 patients were put on hold, and how this delay has put additional strain onto the backlog of already pressurized environment? And you did mention earlier you're in the ICU sectors. So has that had an impact?
Yeah, look, I think that's been the issue worldwide, right? So in preparation for the whole pandemic, in wave one, all the elective surgeries came to a halt. So anybody who was waiting to have a knee replacement or hip replacement, even an elective cardiac bypass procedure, were all put on hold so that the facilities could be reserved for the anticipated onslaught in terms of COVID numbers. And that had to be done. If we looked at all of the projections that were done in the early stages of the pandemic, it was projected that hospitals would be brimming full. We all had to try and set up field hospitals as well in anticipation of the load. So it was appropriate then to cancel all elective procedures. Once we got through wave one, immediately then elective procedures were done again. And we had sort of a window period of about 2.5 months to do those procedures. And then wave two hit us. And again, then they went on with many procedures up until we reached the peak, sort of end of November, where again, all the elective procedures had to be cancelled and only emergency procedures were done. So yes, unfortunately, it has been a sad byproduct of the pandemic is that many elective procedures were delayed and then eventually ended up becoming emergency procedures. So there are additional poor outcomes in addition to the COVID-related deaths, if one can put it that way. There have been additional non-COVID related deaths because of delayed procedures. We also saw in many hospitals more patients were coming in with ruptured appendices, ruptured gallbladders. So many things that would have been picked up earlier on, people delayed coming into hospital because they were afraid of getting COVID. So yes, it has had an impact. If we were to go back and think about whether we would have done things differently in wave one, probably not, because it was all, we all needed to be ready. And in wave two, unfortunately, what we probably would still have had to restrict ventilators for patients who may have developed COVID and required that. So it's just unprecedented, and I don't think it was different anywhere, unfortunately. And it is another non-COVID related poorer outcome of the pandemic. Yeah.
Thank you very much for that insightful information. I just want to thank all our listeners and our viewers for sending in those questions that are coming through beautifully. And I hope that we can get through lots more in the time that we have, because definitely it's something that needs to be highlighted. So, Dr. Klali, there's a question for you. Can you speak to the misconceptions media may have perpetuated about fighting COVID-19 and working on the front lines, which the public does not know? Dr. Klali.
That's a very tough question. I think the issue is not the media, but rather social media, because of a lot of conspiracy theories that came around from about the COVID pandemic, whether or not it was made in a lab or it was transmitted via 5G. Yeah, a lot of conspiracy theories which might have obstructed healthcare for a number of patients, as well as some conspiracy theories which were surrounding the vaccines as well, which may have also obstructed the number of people who might have volunteered to get vaccinated. So I don't think the media itself might have perpetuated it. I think the media's role in COVID-19 was really to try and highlight what people are really experiencing, both patients and healthcare workers, in terms of the COVID pandemic. But yeah, social media made life very difficult.
Thank you. And I do apologize in terms of the tough questions coming your way. That's just the way it's been streamed here. Dr. Zalelwa, I'd like to speak with you about the role of being a healthcare worker as well as having COVID-19. Has that impacted you differently as a doctor in the field after contracting COVID-19?
Thank you very much for the question. Contracting COVID-19 as a doctor on the front line has and still is been devastating to kind of my forward trajectory in terms of being a healthcare worker. I am still, there's a lot of people that have had COVID that previously were infected, and they're still struggling with a lot of the symptoms involved, So a few weeks, after I was diagnosed, obviously I went back to work. I wasn't infectious, but I was still struggling very much with the brain fog, with the headaches, with feeling tired, with chest pain, with anxiety, all as a result, of having been infected with the COVID. And essentially, we've got a huge health force, and lots of people who have recovered from COVID, but we haven't fully recovered. And a lot of us still need a lot of support, and we are wounded soldiers, a lot of us. And it just feels like, obviously with the next wave coming and not being sure when the whole nation is going to be vaccinated, we're already under strain as the healthcare workers. So I also have an understanding now, just like when I have the fact that I have an understanding of having multi-drug resistant tuberculosis, I have an understanding of what it's like to actually have COVID. So when patients of mine would come and, be excited to return to work, say, look, we've completed the 10 days. I would be like, okay, look, I want to give you 2 more weeks off. And they'll be like, no, I'm fine, doc, it's okay. And I would be like, look, okay, look, let's do this. I will give you the sick notes and then you will decide, and some of them would come back and just be like, how did you know? And I'd be like, look, it's because I wasn't well, I wasn't 100% well and I wasn't ready to jump into things. So having contracted COVID and being a healthcare worker as well has really broadened my understanding, because I have a lived experience. The things that I'm going through are things that people are coming to me complaining of. And the simplest solutions that I offer are the solutions that help me. So people that have come to me and say they've got chest pain, and I'll tell them, look, I spend a lot of time outside. I do breathing exercises. I try to not be physical, but just try to move around to get more air in. There's lots of these little things that only survivors can tell you. And I feel like it's a bit of a superpower that I have right now, that I can actually understand the lived experience of the person who is coming to me. And I wish we could all, as health workers, I wish we didn't have to fall sick to understand. But essentially, for all illnesses, I wish we could have an understanding, and that understanding comes from survivors. So I'm grateful. As tough as it's been, I feel like I have a scientific understanding sort of COVID, and I have a lived experience, and this is why I continue to be on these platforms, to be able to share these stories and to share with other healthcare workers going through this as well, that look, there's a few of us that are fighting long COVID, and we need to band together and support each other, and we need the world's support, in fact. So yeah, I think that's the experience, that getting sick has taught me.
Thank you very much. And you are highlighting to us that healthcare workers, doctors, humanitarian staff are all people too. People with emotions, people with fears, people with anxieties and vulnerabilities, people who belong to families and communities. So, as much as you are there in the front line, we need to recognize that you probably experience a little more than what some of us experience back home, simply because you are dealing with patients, you are dealing with people on a regular basis, witnessing illness, death to an extremely large degree that I guess none of you ever imagined when you were in your early years of studying to be in this particular field. So, Dr. Tuli, I'd like to ask you, perhaps, being an advocate for young doctors, what would your message be for those listeners out there who are probably in matric thinking of getting into the medical field, or perhaps even medical students right now? What would your perspective be, and how can you just encourage them to continue knowing that what you are experiencing now?
Wow. I have a lot of insights I'd want to share in answering that question. And I don't want to discourage anyone, but I think if you want to go into the medical fraternity, you need to have a long period of introspection. For all young medical students, high scholars, even primary school people, school kids who want to be doctors, like, you need to know that it's not what you see on TV. It can be a highly rewarding profession, but it can also be a highly destructive profession. So before you get yourself into medical school, or before you become a doctor, you truly need to prepare yourself. Ask questions, ask what it's like, speak to people on a personal level, not on a kind of glorified level. Get to understand what the profession is about. And only once you understand, follow through with it. I won't lie, I don't regret following through with being a doctor. I really love my profession, but I really wish I knew some of the things that I know now before getting into it, because I think maybe I would have been better prepared. Thank you.
Thank you for that. We have a comment from Zaytun who's watching the webinar on YouTube. She says, my niece is a gynecologist in a hospital, and every day when she comes home, she has to change clothes in the garage, then march straight through to the bathroom without greeting her family and her husband. And they have taken enormous strain on this. Would anybody like to respond to this within 30 seconds, please?
Okay, I'll take this one, I guess.
Thank you.
I think yes, as a my first kind of thing that brought me towards COVID was misconceptions. Um, and what I've realized with COVID is that it has kind of also led people to doing things that are relatively, inappropriate or ineffective. Um, One needs to understand the mode of spread of the virus before understanding what measures you need to put in place to protect the next person. I know in the beginning there were videos of people being sprayed with sanitizer in order to enter a certain facility. That is all unnecessary. What needs to be done is just make sure that your hands are always washed. Um, Stay away from touching your face with unwashed hands and wearing a mask. The rest of having to shower and all of that is really, really not necessary. Thank you.
Shahana, if I can just add to that, I would agree with that completely. We've in the ICU been involved in putting patients on ventilators. We've been down patients' throats and lungs with tubes and pipes, and we haven't needed to resort to that. So just first principles, wearing PPE, as Dr. Klali correctly said, we know a lot more about the virus and its mode of spread. So I think we just need to be sensible about what we do and read up a bit more. There's no need to be that anxious and panicky about it. And then just to answer the other question about whether we should encourage people to do medicine, if I could go back, I would definitely still do medicine. I think it gives us a unique opportunity to touch people's lives in ways that we're not privileged enough to do in many other spheres. And I think, as Dr. Klali rightly said, just empower yourself, go out, speak to doctors in government hospitals, in private hospitals. I think we need more doctors. We need more people with empathy who share calling. So I would encourage many people to do medicine. I wouldn't change my mind. I don't see myself doing anything else.
Thank you very much, Dr. Hussein. We've got a comment from Zubaida who says salams and thank you for a very informative and rather crazy, rather scary situation. May all the frontline health workers be protected, as well as all of those who try and assist. May the panelists be rewarded, inshallah. Ameen. Jazakallah Zubaida for that. So we've just got a few moments left before we're finishing off. There is a question here, and we can see who wants to take this one. Taking into cognizance the enormity of the contribution and sacrifice of the frontline health workers, shouldn't the state or even the immediate families of the deceased acknowledge us by placing a plaque at the hospitals, or going forward dedicate a day in the year to the frontline workers, especially those who have sacrificed their lives? Would anybody like to comment on that?
I would like to make comment.
Thank you.
Hi. I very much appreciate, that idea. And I think that would definitely be a great idea. But I think my biggest call right now to the global world in terms of assisting the healthcare workers is tangible help. It's really great, to be acknowledged as a person, who has assisted so much in people's lives. It is great, but we are still working. We're not sure when COVID is going to end. We don't know when things are going to get better, and we are running on empty, a lot of us, And I think if anybody right now watching today could ask a healthcare worker, you know, how they're doing and how things are going, and if there's anything that they can do, you know, to help them out, I think they would be doing the world and humanity a great service, you know, because who is caring for those who care about us? You know, we need to be cared for too, you know, in order to offer a great service. Because I think everyone can tell you, you know, a happy doctor is a great doctor. A doctor who is there and healthy and fed and rested is a doctor who can actually do the work efficiently, you know. And the work right now is to end this pandemic. And in order to do that, we as healthcare workers, as people on the front line, we need your support. We urgently need your support, so that we can lift humanity, you know. So I think all of the ideas would be great. I think anything that anybody could do, the plaques, anything like that would be amazing, but really tangible help, you know. I'm talking about meals, I'm talking about psychologist appointments, I'm talking about, you know, anything that can allow healthcare workers to actually feel like they can go back to work and do their job and kick this pandemic and, you know, all of those great things. But we need support, we need help, we need love, we need anything you can give us so that we can lift humanity. So yeah.
Thank you. I have the image of kicking the pandemic, and I'm sure most of us would just like to kick it out of the arena, you know. But definitely, it's something that we need to just work around and prepare for. So we have a few more moments still left for our ITV viewers. Thereafter, we will then go onto our social media platforms just to finish off our discussion from here. So for now, I'd like to thank the ITV viewers for tuning in and being part of this discussion. Brother Yusuf, I'd like you to give us a 30-second perspective on the question I asked earlier about the plaque, about the commemoration of healthcare workers.
I think that my perspective on that is slightly maybe different to Doctor that mentioned that spoke earlier. You know, for me, I think we always say at Islamic Relief, you know, we don't choose to work at a humanitarian organization. You get chosen for this field. I can really vouch for that. I had not planned to be involved in the humanitarian sector, but I've been here now for the last 4 years. Been the most fulfilling time or period in my life. So I don't think we need the acknowledgement. We don't do it for that. We do it purely for the sake of our Creator. And I think the support that we need to be able to do what we do is, as I mentioned earlier, to reach more people, we need resources. And that's where the community can support us. We are on the ground, not only us, other organizations like us, support these organizations that are working on the front line in the humanitarian field. But honestly, we don't need and we don't ask for any other kind of acknowledgement. Shukran.
Afwan, thank you for that response. Am I correct in assuming that the medical fraternity in private practice experience similar realities to what doctors in the hospitals, either private or community hospitals, are experiencing? Because the private practice arena is usually the first port of call. Could maybe Dr. Halfi just give us some perspective on that, please?
Shahana, look, I think if you listen to Zolelwa and Dr. Tlali, you know, I think our experiences are probably very different. In private, we've obviously got a group of people who come from a higher income bracket, so they have access to private healthcare, you know, compared with the facilities that our colleagues have been working at. So they do have easier access to medicine. So I do think there's obviously that divide. You know, this is the nature of private medicine, is that there's a small percentage of people in the country that can afford medical aids, and they unfortunately have access to healthcare easier than somebody in a government facility, with the result that ventilators had to be rationed in government hospitals, whereas in our hospitals, we were able to utilize them for patients who would have been turned down in government hospitals, unfortunately. So there's a big divide. There really is, unfortunately. And yes, it would be great if the public facilities could be improved, if more funds could be funneled that way to improve the support that they get. From a private practice perspective, I can't complain. From my perspective, we did medicine, we signed up for this. It's our time to now show that we mean what we the oath that we took, it actually not to just pay lip service. And so I feel we got to do what we said we would do when we started off. So I was very happy continuing with this. And I think, yes, we have been shown a lot of support. In the Western Cape in particular, there were lots of initiatives delivering various eatables and sort of packs to the staff and the patients. So we've seen the good side of it, but unfortunately that hasn't filtered throughout the country, so I can see why Zolelwa and them have had different experiences to ours. But yeah, I mean, we've had a reasonably good experience in private practice from the support point of view.
Thank you, Dr. Khalfi, for that. So we're going to be closing off soon, and I'd like you all to just take this question into account as you give us your closing remarks. It's come through and it asks, it's been 1 year since we went into lockdown. What has been your lowest moment and how did you pull through? So perhaps in your closing remarks, you could just add your response to this question that's come through, please. And can we perhaps ask Dr. Zulelwa to start her closing remarks for us, please?
This is a really difficult question. I've had many low points. And I think my lowest points in closing, I think I love my work. I love being a doctor. I love having the impact that I have. And I really do believe that I've impacted millions of lives in the time that I've been working, I just have this constant thing that happens to me where I fall ill or I get into a car accident or something bad happens to me because of the profession that I have chosen, and I don't think it's okay. And that's why, I was a bit worried about that question when you asked Dr. Tlali about what he would suggest to other people wanting to go into medicine. I think currently, globally, it seems like it's not safe to be a health worker. And this is just a really tough struggle I'm having to deal with over and over and over again while trying to give of myself, where you get hurt, and it's because I think globally health systems have not seen us as people, as people requiring support to actually do these life-changing procedures, So I really feel sad. I'm happy I went into medicine, but I'm sad because I feel like we don't have voices as healthcare workers. We don't have the opportunity, opportunities like this, to speak globally and tell people that, look, we are struggling, we need help, and we're just expected to go on. So I think my closing remark is that I need it to be safe again. And it seems like it never was safe. And I want to challenge the world. How do we make the healthcare centers safe for the health workers and for the people that are accessing the health services? Because even now, people are afraid to access them because they're not safe. So how do we get the health sector to be safe for the people that work for it and the people that it serves? And I'm here, to try find those answers. So I'm really grateful for this opportunity. Thank you very much. And I hope this conversation continues.
Thank you very much, Dr. Zulelwa, and thank you for your honesty. I think that's what it comes down to. And the fact that you are in advocacy, that honesty is really something that will infiltrate and perhaps assist you a lot more in getting things done on the ground as well as in further developments as well. Dr. Tlali, your closing comments, please, with the question that we've just asked as well. Thank you.
Thank you very much. Before I go into the question, I just want to thank everybody who's watching, and thank you very much to the Academia and Library for this opportunity to get to share my experiences. For me, the low of last year was, I remember, I just have this vivid memory of driving into the clinic and seeing a long line which goes around the fence of the clinic, knowing exactly that the number of healthcare workers at the clinic was less than half. Starting to see patients and making silly mistakes that I otherwise wouldn't make because I was burnt out. I remember one time I even swabbed the patient without wearing the appropriate mask or the appropriate gear because I was just so burnt out. And ironically for me, as opposed to my colleague Zoe, what saved me actually was actually contracting coronavirus, because I was heading down a very, very dark path. And that time that I spent away from work, away from the patients, away from everyone, was actually a relief for me, because had that not happened, I don't know what would have happened to me. Thank you.
Thank you for that. It's interesting, your savior from long hours, which we know doctors are facing anyway, from being burnt out, as you mentioned, was actually contracting the virus. So I guess, there is good in adversity. It's just about how we perceive and how we experience the adversity and what we take from it in terms of moving ahead and moving on to prepare ourselves better for our days ahead of us. Thank you for that, Dr. Tlali. Dr. Hussein, your closing comments, please, with the question that you've just raised as well. Thank you.
Thanks, Johanna. So I think for me, the low points have been the number of patients who haven't survived this. We've just seen so many deaths in the ICUs across the country, but we've also seen so many deaths. And to see a colleague lose his mother and his brother, to have a best friend on a ventilator, to see a 25-year-old mother safely have a baby delivered, but then for her to die, has been really rough. So I think for me the lowest points have been all the deaths that we've seen in the ICU. I think also a low point, but it's probably a sobering point in a way, is recognizing the limitations of medicine. So no matter what we do and how much we do, despite all the interventions we institute in ICU, which would normally have saved a life in any other medical illness, with COVID, it wasn't enough. So you do everything you can, you do your best. Some patients will survive and others wouldn't. So for me, those are the low points. But I'd like to take more positive points away from this and say that what we do recognize in ICU is that the patients who didn't survive have been those who were overweight, those who had bad hypertension and diabetes. And for me, the biggest lesson from COVID is that we need to look after our bodies. We need to be more healthy. We need to exercise. We need to reduce our vulnerability to getting COVID, in addition to all of the other measures we institute. And this is where we've got to compliment guys like Brother Yusuf as well for changing the lifestyle of people and making them less vulnerable on a larger scale. And if we don't realize that we've got to look after our bodies, then we haven't learned much from this. And I'm also very proud in the whole humanitarian outpouring towards this, and the humanity shown by individuals, colleagues like our doctors on the panel, and all of our staff and our nursing staff. So yeah, I'm proud of the response to this, despite all the low points.
Lovely to hear the lessons, and definitely something to take note of in terms of looking after our bodies, looking after ourselves. And I like the fact that you speak about reducing the vulnerability. Thank you for that. Brother Yusuf, can we have your closing comments, please, and also your answer to the question?
Yeah, thanks, Sister Shana. First, since it's my closing remarks, I'd like to thank the Academia Library for arranging this very important seminar. As I said, it's we won't be able to do justice in thanking our frontline workers enough. Dr. Tlali, Dr. Sifumba, Dr. Khalfi, to you guys, just listening to you, it's an inspiration. You guys put your practice, you've taken the knowledge that you've been granted and putting it into practice in a way where you're putting your lives on the line. And not only you guys, but the entire medical fraternity that you represent. My utmost respect to all of you. And the other frontline workers, whether it's nurses, the cleaners, all the staff at our public and private hospitals, we really owe you guys. I mean, we can't express our gratitude enough. And then likewise for myself, as I mentioned, I'm not only representing myself or as CEO of Islamic Relief, but the entire humanitarian sector. The workers in the humanitarian field that really go out every day working in communities where we know there may be a high infection rate, but they're also putting their lives on the line in order to protect people by limiting their movements, and not only protecting them, but then protecting the rest of the community and the broader society as well. There are so many stories that I could share with you that would maybe be a low point, but at the same time, I think in that darkness, there's always a ray of light and of hope. And, we look at any kind of adversity and we always take the lessons from it. One in particular, I think probably the lowest that I felt during this time of pandemic was with a refugee family. And again, this is one of the vulnerable groups within vulnerable groups. A refugee family where it was a mother that had 5 children. The father had already, been lost to the family because of drugs. But the mother died of a heart attack, and she left behind 5 children, the eldest being a 16-year-old girl, and the youngest was a 1-month-old baby. And those children were now completely on their own. And it came to our attention that that day, as I was leaving the office, that they had no food at home. Somebody had delivered a pack of 6 liters of long life milk, for the children. And I was at home that evening. I couldn't eat because I was thinking to myself about, I'm sitting down with my family having a meal while there are 5 children that I know of that have nothing else, and a small infant having to drink long life milk, not even baby formula for the child. But again, as Dr. Khalfi mentioned earlier, this is what we signed up to do. And we have to do as best we can. Wherever we are able to help, we have to do so. This is our commitment. This is our calling. And, again, being granted, again, a unique opportunity by our Creator to serve creation, to spread mercy amongst these creation. This for me, again, in the darkness, there's always this ray of hope and of light. And then I think what COVID has taught us is just how vulnerable we are as human beings. Sometimes we think that we are invincible, that we have all the answers. What COVID has taught us is that we are not. We are very fragile. And indeed, we don't have the answers. Even now, we still don't know exactly how this virus works and how to contain it. A small microscopic virus that we can't see unless it's under a microscope. So this, again, I think as humanity, we can take many lessons. One of the most important being, as I said, our vulnerability. We're all in this together. We have to help one another as a big human family. And we can get through this. We can pull through. And we just have to, support one another as best we can. Thanks, and shukran.
Shukran, Brother Yusuf. The words vulnerability and support have come up many, many times. And I think it's something that we definitely need to take heed of. Thank you for sharing with us. So a comment has come through, which I'd like to just read through quickly. I feel it's not right that the only relief is falling ill. The only way to have a break from the hardship, and this shouldn't be the way. The only way to get time off is to fall ill and risk death. So many of the doctors feel that way. And that's the reality that we face. That's the reality of our frontline workers face. I'd just like to thank each and every one of you panelists for sharing your humanness, sharing your vulnerability, and allowing us to receive the plight and hear the sacrifices that all frontline workers make. They endure this so compassionately. and each and every one of you, Brother Yusuf Muhammad, we implore South Africa Islamic Relief in addressing the critical needs of the vulnerable people. And you've highlighted the humanitarian aspect of that in terms of COVID-19. Dr. Tlali, thank you for bringing into our attention the additional dimension of challenges that communities face on the ground level, and also for being an advocate for mental health in terms of doctors and bringing in the new wave of doctors to see to our communities. Dr. Hussein Khalfi, you have brought in a sense of compassion, and your message of humility comes through. And those are things and those are values which need to be internalized and highlighted for one and all. And then Dr. Zulelwa, you've risen above your adversities and you've been brave and courageous to step into your reality. It's a voice that we hope will be a catalyst for change in terms of your advocacy work that you do. So thank you very much once again to all our panelists for participating in this most enlightening conversation that we've had this evening. I need to end off by thanking the academia team for making this platform possible tonight. Dr. Ilyas Parker is a well-known name in our community and is also the chairperson of the Al-Ikhlas Academia Library. And thank you for just being a forerunner in what the Academia Library is doing. Anwar Abdurrahman, you are the treasurer of the library and is taken over the technical aspect of flighting the program. Thank you. Shanaz Ibrahim Giri is the content producer for the webinar series and behind the scenes contacting each of the panelists, ensuring that everything is on track and on time. Thank you for your meticulous nature. Shabuddin Rumani in assisting and preparing for moderation. Mahmoud Sangle as a committee member, as well as Dr. Yusuf Patel, both committee members in terms of support and in the background, but definitely being there as support structures for the webinar. And then last but not least, Mohammed Jaffer and his team here at the On-Screen Production Studios. Thank you very much for entertaining us initially before we started the webinar and just for ensuring that everything has gone through so smoothly. And we do hope that this evening has been beneficial to all through On-Screen making this production live for everyone else. So with that, I bid you farewell. I thank you for your ears, thank you for your heart, thank you for your eyes, thank you for just being participative in this discussion, and we wish you well. Academia Library will be having more webinars which will be sent out via their social media platforms. Assalamu alaikum wa rahmatullahi wa barakatuh.